at that time if you wish to verbally ask a question. One disclaimer before we start, this is an educational presentation and we will not be discussing plan specifics during the webinar, nor will I be addressing programs like medical assistance. If you would like specific plan information and options upon your request, we would be more than happy to set up a personal one-on-one appointment. So, Holly, I think we are ready to begin.
All right, I've got everyone muted and we are all set.
Good. Okay. So again, my name is Barb, and Holly Alleman is another licensed and certified agent in our office. So the two of us will be presenting. All right. So our goal today is twofold. We're going to simplify Medicare, and we're going to teach you, hopefully, learn how to make an informed decision. The agenda for the next hour is some basic Medicare facts, original Medicare, reviewing what original Medicare does not cover, and enrolling timely. I'd like to see a question in here. And the first one is, what year was Medicare passed into law? And I know those of you that are on just the phone with us won't be able to see our options, but I'll verbalize them. I'm going to give a couple of options. Was it 1945? 1955, 1965, or 1975? Give you a moment to think. When did Medicare pass into law? And the answer, and you can see I've got a big picture here. It's kind of an infamous picture of President Lyndon B. Johnson. So that gives it away. The answer was 1965. Medicare is having its 55th birthday this year. So some basic Medicare facts. What is it? Well, Medicare is a government health insurance program. You sign up through the Social Security Administration. You're eligible at age 65 even if you do not retire. If you're under age 65, you may qualify with certain disabilities and if you're drawing Social Security benefits. It's administered by an agency, a federal agency we call CMS, which stands for the Center for Medicare and Medicaid Services. It's basic affordable insurance. Most people look to private companies for additional coverage. It was first created in two parts, the letter A and the letter B. Together, this is called Original Medicare. Some people will call it Traditional Medicare. There's possible penalties if you don't sign up for certain parts timely. You may, however, be able to delay Medicare if you're still working on an active group insurance. This next slide, and I know again you folks on the phone can't see this, but I have a picture of a red, white, and blue Medicare Health Insurance ID card, just a sample that we found off the web to show you. And most of you have probably seen this. This again would be sent to you by the Social Security Administration. It has your name on top. It has a random number. They did away with Social Security numbers a couple of years ago now, and you'll see that Part A and Part B, and then the date that the coverage starts. And to be honest, I do not like this sample because it says that this person is eligible March 3rd of 2016, both A and B, and coverage always begins the first day of the month. But this is what we found, and we wanted to give a visual. So I come to the next question, trivia question number 2. So we talked about Medicare A and Medicare B. What other parts to Medicare are there? Is there a C? Is there a D? Or is there a C and a D? The answer, you'll see I have a little puzzle here with 4 pieces, A, B, C, D, C, and D. So there is a Medicare Part C and a Medicare Part D, which are private Medicare plans, and I will be talking about those in just a few minutes. So, but let's go back to original Medicare, you know, that red, white, and blue card that is called Original Medicare. That's your ID card for this coverage. What is Medicare Part A? Well, you see the visual here of the hospital. Medicare Part A is hospitalization insurance. It helps cover, in addition to some inpatient hospital, skilled nursing facilities, some skilled nursing, hospice, and some home health. It's free if you've worked 10+ years of Medicare covered employment and you're eligible for Social Security benefits. Now the next slide, you'll see Medicare Part B. You'll see the cute little picture of the doctor with the stethoscope, the cartoon character. Medicare Part B helps cover things such as doctor, other provider visits, outpatient care, many preventive services, diagnostic tests and x-rays and supplies. I like to think of it as the people services. Medicare Part B has a premium. Unlike Part A that most people get for free, Part B has a monthly premium, and if you're drawing Social Security, that premium is auto-deducted from that Social Security check, or if you're not drawing Social Security benefits, you will receive a bill from the government. So what is that premium? That brings us to my third trivia question. In 2020, what is the standard premium for Medicare Part B? This changes every year, and we find out in the latter part of a calendar year what the premium is for the upcoming calendar year. So our choices, $99.50 a month, $144.60, or $187. Answer, and this next, you'll see a grid here, and I'll talk about that in a moment, but the answer is $144.60. Now, Medicare Part B is what they call means tested. And what that means is, is that if you are in a higher income bracket and they have a 2-year look back, so if your yearly income in 2018, what you pay in 2020 is above certain thresholds, you will get a polite little letter from Social Security stating that you may be assessed a higher Medicare Part B premium. And this slide, and I pulled this right off the Medicare.gov website, will show you what those thresholds are. Currently, again, income in 18 for what you're paying this year, if you were a single tax filer, it's $87,000 or less. If you're in that bracket, you're going to pay $144.60. Married filing joint tax, it's $174,000 or less. You will pay that standard $144.60. But if you're higher, and there is 5 brackets higher of income levels, it could be as high as $491.60 a month. That's for single filers, making over $500,000 a year, or joint filers making over $750,000. Social Security will be in touch with you if you're subject to the higher Part B premium. Now, we've talked briefly about what original Medicare covers. What might it not cover? Why do people look for other coverages? Well, Part A and Part B have deductibles. Part B, for most services, again, this is like the people services, the providers, if all you carried was that red, white, and blue card in your billfold, you had original Medicare, you would be responsible for 20% of most, not all, but most Part B services. And there's no out-of-pocket maximum on that. Most prescription drugs are not covered under the red, white, and blue ID card, the original Medicare. Most prescription drugs, you need to buy a Part D prescription drug plan, which is a private plan, totally separate from original Medicare. An annual physical exam is not eligible under original Medicare. They do cover wellness, but those are different than annual physical exams. Glasses, hearing aids. Most health care outside the United States, not covered under original Medicare. So, what about these private Medicare plans that you see a lot of advertising for? And if you're aging into Medicare, approaching Medicare, which I suspect most of you are probably getting a lot of solicitations in the mail. I know when my husband turned 65, I had, I think the stack was 6 inches high. So there's a lot of private Medicare plans out there looking to see if they might be best suited for you. Where you reside determines what plans you're eligible to consider. Very important. Where you reside, the state, the county where you live. And it's very important to understand the type of plan you may be interested in. I hear a lot of people will call me and say, oh, I'm interested in the Medicare Supplement, but there's different, that's just one type of plan, and we're going to talk about that in just a moment. And here we are, types of Medicare plans. And I'm going to talk about 4 today. And I know I'm going fairly quickly because I'm trying to give an overview of a big topic, simplify it. Remember that we can answer questions later or meet with you individually upon your request. But the 4 types of Medicare plans I'm going to address, number 1 are Medicare Supplements, number 2, Medicare Advantage, then I'm going to talk about Medicare cost plans, and finally, Medicare prescription drug plans. So the first one's a Medicare Supplement. They're also known as a Medigap plan. It's a medical-only coverage plan, and there are different types of plans available. Always pays secondary. That's what a supplement means. Medicare would be your primary insurance. The supplement would be your secondary. So if you went to the clinic or the emergency room or the hospital and you had a supplement, you would show both your red, white, and blue card. The claim would go to Medicare. What they didn't pay then would go over, would cross over to your supplement. Generally, they are not network-based. And what that means is any doctor that takes Medicare in the U.S. will take you. You don't have to worry about, do they accept my supplement? Do they, because Medicare is your primary insurance. So you just need to make sure that your doctor takes Medicare. They're portable. This is a term that is very important, especially if you think or the possibility down the road that you would move within the United States. I've had a number of people over the years that they had to be a Minnesota resident at the time they bought a Minnesota Medicare supplement, and perhaps down the road they moved to and made it their permanent resident, Arizona, where their winter home was. They were able to keep that supplement even though they lost their Minnesota residency. It's one of the advantages of a Medicare supplement. It's portable. Another term that's very important to understand about a Medicare supplement is that the benefits are guaranteed renewable. It's a big term, but what that means is that the benefits do not change from year to year. You will not get a letter that says, oh, now we're going to have a higher deductible or a higher copay at the clinic or whatever. Once you enroll in that plan, those benefits will remain the same. The premium could go up, but the benefits will remain renewable year after year. The most attractive time and the most popular time that people enroll in Medicare supplements is within 6 months of going on Medicare Part B. That's called an open enrollment period for a Medicare supplement. You can enroll afterwards, or I should say you can apply afterwards, but you would likely have to submit what's called a health application and be accepted. To avoid doing a health history and a health application, if you do it within 6 months of going on Medicare Part B, they will guarantee accept you. So let's talk about Medicare Advantage. Medicare Advantage are different types of Medicare plans. It's like private Medicare. It's also known as Medicare Part C, and it's an all-in-one alternative to Medicare. It bundles your A and B coverage, and it usually includes drug coverage, which would be Medicare Part D. You do not use your Medicare red, white, and blue card if you enroll in a Medicare Advantage plan. The plans vary by state and county, and they change annually. You receive a notice every year, and it's due in your mailbox by October 1st, and it tells you what may or may not change for the upcoming calendar year. They will tell you the difference in premium and in any benefit changes, of a copay changes or a deductible or a coinsurance or whatever. Medicare Advantage plans are year-to-year plans. Medicare Advantage plans generally have what I sometimes will call the bells and whistles. They're not just a medical plan in many cases. They will add benefits such as vision, hearing, perhaps dental may be bundled all into it. So if you go with Medicare Advantage, you will more than likely just carry one ID card. That would be your Medicare Advantage plans. You see a lot of these being advertised on TV. Medicare cost plans. So Medicare cost plans, that's a confusing term, but it's a type of plan that's a hybrid. It works like a hybrid, which means it's a little bit of supplement and it's a little bit of advantage. They are only available in certain parts of Minnesota and in some western parts of Wisconsin where we work. They have some advantages because they have some flexibility with them. You can buy a Medicare cost plan as a medical only plan, or if the plan offers the prescription Part D and you like that coverage, it's affordable, it covers your meds, you may want to include what's called their drug rider and have it all in one. Or you can buy your prescription drug as a separate standalone plan. Lots of flexibility. With Medicare cost plans, unlike an Advantage, you retain your original Medicare. So if you enroll in a Medicare cost plan, in your billfold, it would be recommended that you would carry both your red, white, and blue card and your Medicare cost plan ID card. They will coordinate if you have a claim. As I mentioned earlier, they're only available in certain areas. The plan availability depends on your state and county. Medicare cost plans are very popular in our area. Pine, Aiken, Carleton, Mille Lacs, Kennebec, St. Louis County still offers them. There's 21 counties in Minnesota that still have cost plans available for sale, and there's several companies that still offer them. They went away, and you may be aware of this, it was a big news item 2 years ago. In 2018, there was over 300,000 Minnesota Medicare beneficiaries who were enrolled in Medicare cost plans, but they lived in one of 66 counties where they went away. They were what they call sunsetted. So those people then had a special enrollment to choose at the end of 2018, starting in 19, either a supplemental or an Advantage plan. But in this area, and again, it would depend on where you specifically live, there still remain a nice option for people to consider, very nice option. These are also year-to-year plans. So like an Advantage plan, though, they are year-to-year. So you will get an annual notice of change if you enroll in a Medicare cost plan. The benefits could change. They're not guaranteed to be the same or to even offer coverage for the upcoming year. Like an Advantage plan also, they may offer those extras like vision, hearing, and dental. And I have seen that quite frequently with cost plans. Now the final private type of plan that people consider when they go on Medicare is a Medicare prescription drug plan. Those are also known as Part D, a Part D plan. And these have only been around since 2006. So I've been selling Medicare, working with Medicare since '96. So for 10 years, we did not have prescription drug coverage for most plans. Medicare Part D was not into effect yet. But starting January 1st of 2006, Medicare Part D became law. And Part D plans can be sold as a standalone or included with certain plans. And that can be a little bit confusing. So as you evaluate your options when you become eligible for Medicare, make sure you work with someone or you're very clear on understanding as you evaluate these different types of plans. Can I buy my drug coverage separately, or if I choose this plan, must I go with the plan that has it included? Like Advantage and cost plans, the prescription drug plans will vary by the state and county in which you reside. There's coverage levels, and one of those coverage levels is called the donut hole, also known as the coverage gap. And I'm going to be touching base on the coverage gap or the donut hole in just a minute. These also change from year to year. An annual notice of change is sent out advising you what changes will occur and reminding you that you can make changes during the annual enrollment in the fall. Medicare Part D or Medicare prescription drug plans have a penalty for late enrollment. And I'm going to show you in just a moment a picture of the window of time that it's best to sign up for Medicare prescription drug plans to avoid a penalty. There's also something called subsidies available or known as LIS, and this is so important, and I think a lot of people sometimes are not aware of this, but if you're in a situation where you have a limited income or limited resources, there's a program through the Social Security Administration called the Extra Help Program, and you do have to apply. And then you receive either an award letter or they may say you're not eligible. In the event you're eligible, it gives people a tremendous amount of help toward the premium as well as lowering co-pays, possibly eliminating the donut hole. So I always tell people, if you're in a situation with limited income and limited resources, if in doubt, check it out. Really important to check into that possibility of some financial help. So this slide, this next one is called the Standard Part D design. And it's got a lot of color on the slide. So again, I know you folks on the phone aren't going to be able to see this, but what it is, and I'll just give a high level overview, but it just shows you what in 2020, what the Standard Part D design is, what the minimum amount of coverage that a company that's offering Medicare Part D must offer. Plans will vary. So there's many companies, like in my county here, Pine County, I believe there's, if I recall right, there's like 29 standalone prescription drug plans, and then there's various cost plans and advantage plans that include Part D coverage. So there's a lot of options out there for Part D, and the plans will vary between these companies, but this design, this graph that I have up here is the minimum coverage that must be provided. So if you look at this colorful chart on the right, you'll see at the very bottom, on a standard plan, it would have an annual deductible, and in 2020, that's $435. So if a person had a standard Part D design, they would pay the first $435 in a calendar year for their covered meds under their prescription drug plan or Part D plan. Then once that's satisfied, you enter into a level of coverage called the initial coverage level. And in this case, on a standard plan, you would pay 25% of the cost of the meds. The plan would pay 75% until the overall cost of your covered meds is $4,020. So for example, if you had a $100 med, you paid $25, the insurance company paid $75, that $100 would go toward that $4,020 of total cost. It's a combination. Every month that you're on a Medicare Part D plan, you will receive a report from the company that you sign up with telling you, what meds you filled, what the cost was, what you paid, what the insurance company paid, so that you can keep an eye on where you're at on these coverage levels. You'll notice then as you move up the chart, we enter the next level after the initial coverage is the donut hole, or again, the coverage gap. So if your overall meds exceed $4,020 in a calendar year, you would then move into the coverage gap or the donut hole. In this case, you would continue to pay 25% of both covered generic and covered brand drugs until the annual out-of-pocket threshold, which is $6,350, is met. And at that point, if that would be a lot of meds, but at that point, you would move into the top level, which is called catastrophic coverage, and you would pay 5% of eligible meds. Now, most plans that I work with are not designed like this, but again, this is a minimum. They have to have this or better. Most plans, or many plans, will have a lower or a zero deductible. Some have the $435. I've seen some in the 300s, 200s, some are zero. And a lot of plans offer a flat copay or perhaps a different percentage amount in the initial coverage limit. There's also tiers of meds, and you have to be sure that your drug is on the formulary, and we're going to talk about that in just a little bit too. But what I'm getting across on this slide is that there are levels of coverage. There's many plans out there on the market, and I strongly encourage anyone that's looking at enrolling in a Medicare plan to work with a trusted advisor who can look at your situation, look at your respective meds, evaluate different programs for you. There's some wonderful reports that can be generated that can lay out anticipated costs, what levels of coverage you can expect. Certainly things can change throughout the year. We're all aware of that. But there's some wonderful tools out there. Medicare.gov is a wonderful tool that we all use. If you're computer savvy, I encourage you to explore Medicare.gov, where you can evaluate these different programs, enter your meds, enter your pharmacy, look at your anticipated costs. Some wonderful, wonderful reports that can be generated on Medicare Part D. Just a word on the Extra Help program, because I always like to plug that. The Extra Help, again, is a program sponsored through the Social Security Administration, and it's for people with limited resources and income. And again, I kind of reiterating what I said earlier, it may help with your premium, annual deductibles, and prescription copays. And you can contact the Social Security Administration, the state Medicaid office, or the senior linkage line. There's also a website here, ssa.gov/extrahelp for information online. But if in doubt, I'll say it again, check it out. And the late enrollment penalty, I had alluded to that a little bit earlier, and I generally get questions on the late enrollment penalty. So Medicare Part D is certainly optional. No one's going to require that you enroll in Medicare Part D, but if you decide not to, and you don't carry what's called other creditable prescription drug, for example, a VA, that would be creditable coverage. You would not be penalized if you didn't sign up for Part D because you had VA and later signed up. But the late enrollment penalty is it's a figure, a dollar figure, that's added to the company, the premium from the company that you choose, and it's a lifetime penalty. And the Social Security Administration calculates it. What they do is if you delay Medicare Part D and again have no other creditable coverage and you later sign up, say I had a person that waited 10 years, they just chose not to have Medicare Part D. So they waited 10 years. Finally, they started taking some fairly expensive meds, and they said, you know, it's open enrollment. We got to sign up here. So they chose a plan, and if I recall right, it was roughly $30 a month. Well, they had gone 120 months. 10 years times 12 months is 120 months. So what the Social Security Administration did is they took 1% of the average monthly prescription drug premium across the country, and that changes every year. It's somewhere between $30 and $35. So let's say that it's $35 a month, and I don't know that figure exactly, but it's in that ballpark. 1% of $35 would be 35 cents. You take 35 cents, and this person went 120 months without, so that came out to $42. So that $42 is the late enrollment penalty for that year. That was added on to their plan premium that they chose, and like I said, I believe the plan they chose was somewhere around $30. So instead of paying $30 a month, they then paid $72 a month. The insurance company that they chose receives the notice from Social Security stating that, you know, so-and-so has a late enrollment penalty, and this is what you have to add on to their monthly premium bill. So the takeaway is really consider Medicare Part D when you become eligible. Look at there's some very affordable plans out there. Talk to, you know, if you're working with a trusted advisor, talk to someone about, you know, all these plans. Again, look at your options. They will ask you questions such as, well, do you have other coverage to avoid it? You know, there's certain group plans, VA, military plans, things like that that may qualify to avoid late enrollment penalty. But be sure you're real clear on that so that you don't find yourself in that situation. I mentioned it's a lifetime penalty. I talked about, I'm just reiterating here, that it's added to your monthly Part D premium and that it's not applicable if you have drug coverage that's expected to pay on average at least as much as Medicare standard. And those are some examples there: employer, TRICARE, VA, Indian Health Service. That's called creditable coverage. And for those of you that might have been working in the last couple of years and approaching your 65th birthday, most employer plans, usually around, I believe it's when somebody starts age 64, will send out a notice with their health plan telling you if your group plan has creditable coverage. And they'll usually say, keep this notice, you may need this in the future. Okay, so our final trivia question. See if you can recall all this information. Little checklist, a check question here. So I talked about different plans, and I talked about something called guaranteed renewable. So which plan is guaranteed to renew year after year? Was it the Medicare Supplement, the Medicare Advantage, or the Medicare Cost Plan? 3 choices there. 2 of them are year-to-year plans, and 1 of them is guaranteed to renew year after year. And the answer is the Medicare Supplement. That's our next slide here. Remember, these are also known as Medigap plans. And over there on the left of the screen, I just took an image of, this might be a booklet that you have in your home. It's the 2020 Choosing a Medigap Policy. It's a guide to health insurance for people with Medicare, and it's an official government guide. Okay, so now, all this information I've given you. So what plans are right for me and where do I begin? So now I'm going to see if you, questions that you need to think about now as you approach that 65th birthday and making that decision. And you'll see our little grid here, the gentleman in the gray suit, he looks like he's really pondering it seriously. But the gal in the yellow hair there, I think she knows what she wants because she's got a big smile. Okay, so here's some of your options. And remember, the plans available depend on what state you live in and what county. So you might stay with original Medicare and just supplement it. Maybe you stay with original Medicare, you feel you don't need that supplemental coverage, you're satisfied with the coverage under original Medicare, but you do want the drug plan. Maybe you want all 3, and that's very common. You stay with original Medicare, you buy a supplemental plan, plus you have the drug coverage. Well, now, if you're in one of the 21 counties in Minnesota, cost plans might be an option for you. It might be a very attractive option for you. You can pick a cost plan, just a medical only, or as I mentioned earlier, they have a lot of flexibility. They may include drug coverage that you find very attractive and you like the simplicity of just having it all together. Or you love that cost plan, but it doesn't cover your drugs, or you don't like the price on it, or you found a standalone drug plan that meets your needs and it's more cost effective for you. That is an option. The next choice would be an Advantage. Medicare Advantage plan with medical only. Or Medicare Advantage plan that includes the drug. These are all the different choices of the types of plans. Again, this doesn't talk about the insurance plans themselves, but the types of plans out there in the market. I can't say enough how important it is to understand the type of plan that you are considering. So first things first, just a bit on getting signed up if you're not already. Again, another picture of this red, white, and blue card, this John L. Smith. You need to apply through the Social Security Administration if you're not already drawing Social Security benefits. If you're drawing, maybe you started at age 62, this card arrives 3 months prior to your birthday month. And if you haven't seen it yet, it comes in a bigger white envelope, not a narrow one, but a bigger, kind of a more square envelope, and you have to tear it off. It's perforated. It's on hard stock paper. If you worked for the railroad instead of the Social Security Administration, I'm sure you know this, you go to the Railroad Retirement Board. Here's just this next slide is just some resources for you to get enrolled in Medicare. In this area, well, anyone can call the National Social Security Administration number, 1-800-772-1213. Or here, like in Pine County, the Duluth Social Security office is really, really terrific to work with. I find really nice people, and I sometimes talk to the same person, and that number is 1-855-863-3560. Online, if you feel comfortable on the computer and you're new to Medicare, the online is really slick. www.ssa.gov/Medicare. Not difficult at all to get signed up for Medicare online. So your initial enrollment period, don't miss that. And I have an example here about this initial enrollment period, which is the 7 months surrounding your 65th birthday. And the example is a person that's born September 15th, 1955. June, July, and August. The first 3 months of those 7 months are the 3 months prior. So if you are not automatically, if you're not automatically enrolled in Medicare because you're not drawing Social Security, you can begin taking action, in this case, June 1st, 3 months prior to your birthday month. And coverage then would take effect September 1. So if you sign up June, July, August, coverage begins September 1. You can still sign up your birthday month, September, and 3 months after. That's part of that 7-month window, October, November, December, but your coverage is going to begin later. So you could go without insurance. They'll push out the effective date. They won't go back retro to September 1. So really important to understand these 7 months surrounding your 65th birthday. I have a slide here that says any questions, but I think what we'll do, again, remember we have a chat feature, and when I do these in person, I usually stop and we visit for a little bit, but I think what we'll do is ask you to hold your questions, and then Holly will unmute the lines, and we can just visit then. Or you can call us later too, of course. So now we've got another gentleman here pondering, what do I do when I think about a plan? Well, there's a lot of things to think about. You got to think about the cost, coverage, other coverage in force. Do you have something else available to you? The simplicity and the extras, prescription drugs, the doctor and hospital choice, and travel. These are just some of them, but some of the key ones that I have found to be extremely helpful and things that I cover with people when they are looking at options. So on cost, very important that you are very clear on the premium, any deductibles you're responsible for, co-pays, out-of-pocket limit. Are you the type of person that wants to pay a higher premium and have very predictable costs if you incur some claims, or do you prefer writing a lower premium check each month and quote-unquote pay as I go? Coverage. Make sure you understand the benefit structure. And what if you change your mind? There's a booklet included called a Summary of Benefits, and they're very standardized. So be sure that you read through that or have your trusted advisor. Your trusted advisor will go through that if you use someone. Do you prefer the stability of the coverage year after year? Remember we talked about that guaranteed renewability. Or are you comfortable with reviewing benefit changes yearly and possibly making a change? Other coverage. What if I plan to continue working and have employer group coverage available to me? Very important that you discuss that very clear with your employer. Do you have coverage to the VA or TRICARE, for example? How will that impact looking at something privately? Do you need something privately? Simplicity and extras. Are you interested in a plan that's all in one, so you deal with just one company for both medical and drug coverage, just have one customer service number to call if questions? Are you looking to add the extras such as hearing aids, eyewear, dental, or a gym membership? Remember, we talked about the different types of plans. The supplements are medical only, but like Advantage and cost plans may offer additional perks such as hearing aids, eyewear, and dental. Prescription drugs, very important discussion to have. Have you looked up any meds that you take on the plan's list of drugs? And this is called a formulary, and this can change yearly. Not every company covers the same meds. Do any of your meds require a prior approval or have any restrictions? Do you have a clear understanding of the levels of coverage and the donut hole? Do you think you'll hit the donut hole? Might you work your way through the donut hole and get to the next level of coverage? Again, there are wonderful tools out there where your meds can be entered into the computer and you can get some wonderful written reports with anticipated costs based on your current situation. Do you get the extra help subsidy? That's that financial help from the Social Security Administration for, again, those with limited income and resources. And can you use your pharmacy? You know, I've seen a lot of changes on this over the years. Pharmacies generally may be a standard pharmacy with a company, or they may be a preferred pharmacy, or they may not accept that pharmacy at all, and it may be what they call out of network. So when these reports are prepared, if you work with someone or if you go on Medicare.gov and navigate the site yourself, one of the questions is, what pharmacy do you prefer? You can even, click on different pharmacies to see, how that might differ on your out-of-pocket expenses. And might you have a late enrollment penalty? Doctor and hospital choice. Can you keep the doctors that you currently use? Make sure that the plan you're considering, you understand the network, if there's a network with it. Does the plan, that's the next question, does the plan have a network of healthcare and hospital providers? So if you're looking at an Advantage or a cost plan, make sure your providers are looked up and you've got verification that they do accept your plan. Does the plan require referrals? Travel. This is a big one, especially we're up here in the north. So a lot of my folks over the years are snowbirds. They enjoy spending time, sometimes considerable amount of time in the southern climate in the winter. So something you need to think about is, do I take frequent trips either domestically or internationally? Do I spend a considerable amount of time out of my home state, such as wintering in Arizona or Florida? Make sure you understand your coverage. Does it have a travel benefit, access perhaps to what's called a national network, or will I incur higher expenses with out-of-network benefits when I'm out of the area? And now we have some fall leaves. So the annual notice of change. This is our busy season, and when we help people, we make sure that we are prepared and able to make sure everyone is taken care of during this time, because it's very important that I believe that everyone should look at their program in the fall when they get their annual enrollment. It's called the annual notice of change. The annual enrollment, some people call it open enrollment, but it's really annual enrollment, AEP. That runs in Medicare from October 15th to December 7th. The notice of change is to be in your mailbox by October 1. So if you have a plan that's subject to an annual notice of change, Advantage plans, cost plans, prescription drug plans, they are subject to that annual notice of change. That should be in your mailbox October 1 annually. You can begin discussing it if you have an agent or if you want to call the company or go on Medicare.gov, but you can't make a change until October 15th, and you have through the 7th of December, and then those changes take effect January 1. So it's a busy time of the year, but really encourage everyone to take advantage of making sure they understand what's going on for the upcoming year. Special enrollment is a different type of window of time, and these are year-round. Special enrollment, there's special circumstances, extenuating circumstances. There's a number of reasons somebody might have what we call an SEP. Maybe they've moved. You know, I just had someone recently who moved out east from Minnesota to live near her daughter. She then had an opportunity to buy a plan because she lost her Minnesota plan, to buy a plan in the state where she moved to. I see a lot of people that are working past 65. They're now losing their group coverage, so they have what's called a loss of coverage. They then have a special enrollment to get into a plan. COVID-19, because of a national health crisis, there is some opportunities for people who may have missed other enrollment opportunities to possibly get into a plan outside of open enrollment or their initial enrollment. So these are situations that should be discussed with someone you trust in the event that you have an extenuating circumstance. Where to get help? Well, we've got some resources up on the screen here. For that extra help on prescription drug, I would suggest calling the free health insurance line called the Senior Linkage Line in Minnesota, that 1-800-333-2433. Each county has a rep, but there's also people just on the toll-free number that can help you. And then below that, SSA, that's just the national number for the Social Security Administration. Over on the right side of this screen is our Town and Country, our Life and Health Department. I'm the Barb, Rabe. I've been here again for, I've got about 5 years with Town and Country now, but pushing almost 24 years with Medicare. Jenny Olander is a very long-term agent with Town and Country. She's been with the agency for 16 years. And Holly Alleman, who's on the phone with us today, has a pharmaceutical background, and she joined us last fall, and we are so pleased to have Holly. So all three of us are licensed. We certify with Medicare so that we're able to help people. And in the event that you would like assistance, we do have our phone numbers at the bottom there, both our local as well as our toll-free number. So I don't know if anyone needs to jot those down. Now what time is it? I try to be so respectful because it's about 10 minutes for questions. What we are going to do now, there we are. I'm Barb, Jenny, Holly, from left to right. Okay. And there's our logo. So what we're going to do now is I'm going to have Holly, I think I heard it. Should you unmute the lines, Holly?
They are now, yes.
Oh, okay. Okay, great. Thank you. We're going to end the presentation part, and I know I've given you a lot of information, and we would encourage you to call Holly or myself if you would like some more information. We're going to be posting this webinar on our Town and Country website after July 1st, because our last one is June 30th. So there'll be a replay available after July 1st. In the meantime, is there any questions that I can answer? Any chat questions that came in, Holly?
No chat questions at all today.
Is there anyone online? Just feel free to speak up. It's just a small group today, and I'd be happy to answer it. Or again, you can just call us later too, whatever's your preference. I hear someone. Can I ask you a question? Was it helpful?
Oh, Barb?
Yes. I'm here.
Yes. Barb?
Yes.
Oh, this is Mary. Actually, I got you on the computer. I didn't have to call on everything on the laptop.
Oh, good, good.
Question, because I am going to be 65 in December, and I get it that I have to call on September 1st because I do not receive Social Security yet.
Okay.
And you said that it would be like $144 a month I mean, that's the way I look at it on the
Well,
screen there.
right. So just so you're clear, the $144.60 is the Medicare premium for the Part B coverage. That has
Right.
nothing to do with your, like, a private insurance plan. That's what the government charges you. And if you're not drawing Social Security, they will send you a bill for that. Usually it's in a 3-month statement.
Right.
And then that may change in 2021. We find that out usually toward the end of November, early December, if that changes for the upcoming year. But this year it's $144.60 for the standard Medicare Part B premium. That is
Right.
separate from any insurance plan.
But then, like that penalty thing. So would it make sense to go with the Part D, the late? Because like if it's a late enrollment and I don't take any prescription drugs,
Okay.
At-
Okay, so remember, Part D is technically
This
optional.
time, but should
yeah.
I actually?
My recommendation is that if you're to consider a plan before the end of your 7-month initial enrollment to avoid a future penalty. And there's some very reasonable plans on the market, which I can't discuss today. But I would
Okay.
discuss that. There's some
Right.
very reasonable. I would discuss that with if you're intending to use an agent or whoever your what I call a trusted advisor would be. I would recommend that you seriously consider a Medicare Part D because it's true insurance. You don't know
Right.
if something were to come up, and it's
Right.
yeah. Mm-hmm.
I mean, I go through, I talk to Jenny a lot. I've talked to Holly before. So,
Sure.
I mean, I go through you guys anyway.
Okay, and so
Okay.
you know, when you come in on a one-on-one, we'll discuss that with you and go over
Okay.
some prices. Yeah, good question. Very good question.
Okay.
Anybody else?
I have one.
Yes.
I was wondering, are we going to be able to do face-to-face with you or on the phone only?
No, what you need to do is just give us a call and we'll discuss the timing. It seems things are opening up a little bit, so no, just give our office a call and we'll discuss what the best way to handle your situation is.
Mhm.
Absolutely.
Okay.
We'll work with you. We'll work with you. Part of it might be the timing. We'll see.
Okay, thank you.
But great question. Anyone else that I can help with? Was it confusing or helpful?
Yeah, I think it was helpful.
It was helpful.
It's
Okay.
A
helpful.
little more clear than it was, yeah.
A little bit. Okay. I don't like to confuse people. My goal is to make it easier.
It was easier, yeah.
Okay. Good.
Great.
This is my favorite part about Medicare, is really helping people kind of navigate and understand the process. I really enjoy that piece of it. Well, thank you, all of you. Remember that Jenny, Holly, and I are all available to be of assistance to you. Reach out to us, check our website when we post this webinar. If you'd like a copy of the slides, you know, reach out to Holly and we'll certainly, we can talk to you about getting you a copy of those as well. Any final question before we close out the meeting then?
No, I think that's it.
Okay, boy, we did it within an hour.
I'm done.
Yes, thank you.
Okay, thank you, everyone. All right, stay safe, stay healthy. I don't know if we're going to avoid a rainstorm or not. It's getting kind of cloudy where I'm at. So, all right. Thank you, everyone, for joining us. Have a good rest of the day.
Okay.
Bye now.
Goodbye.
Thank you.
Bye-bye.
Bye.